The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Good afternoon. This is Tony Urbanic, and we are here for the next episode of TMD Demystified. Again, welcome to all your TMD warriors. And today, the topic of discussion and title is TMD and DSOs. I assume that most, if not all of you, are watching this episode, are dentists or dental specialists. If not, I may blow past a word or two that you're not going to understand, but I'll try to define my terms. Voltaire quoted as saying, if you are going to discuss with me, define your terms. You must define your terms. So first of all, TMD is better known as TMJ, and DSO is Dental Service Organization. There are a growing number of dental service organizations. I am told that we are now approaching more than 1,000 DSOs in the United States of America. Dental Service Organization. What is a dental service organization? A DSO is a company that handles for a dentist or a dental practice what we call the back end of the dental service. That is all the business end of it, where the provider, dentist, licensed provider, handles the front end, which is the service provided to the patient, the dental service provided to the patient. So last weekend in Denver, Colorado, I attended the largest DSO convention in the United States of America, certainly in the world, called the DICOMA Convention or conference, DICOMA Conference. And it was hugely attended, 2,000 people, all within the dental industry, many hundreds of DSO participants, doctors, and companies who wanted to do business with the DSO. In today's topic, I'm going to describe and quote, as we say, unpack what I learned there and several things that I learned and that I can apply to TMD itself. My purpose here is to educate widely about the TMD conundrum and how it affects both patients and doctors, and in so doing affects doctors' practices. I have made comments similarly before on these episodes. This episode will be episode 110. Basically, I've been doing one episode per week for the past 2 years. And I find this episode extremely noteworthy. For the first reason is I have known for quite some time that the DSO industry is increasing, not rapidly, but logarithmically, in both numbers and influence in the dental establishment and in the dental industry. It is estimated by good people, good estimates, that within the next 10 years, maybe sooner than 10 years, 80% of practicing dentists will work under the influence or moniker of a dental service organization. Right now, approximately 20% of dentists work with or under a dental service organization. that is predicted to be 80% within 10 years, possibly sooner. What I witnessed in Denver, Colorado at the DICOMA conference, the largest conference for DSOs in the world, that there is a extremely increasing interest from dentists and the entire dental industry and all the companies that supply dentists in the DSO market. Now, it is not my purpose here to promote DSOs or to say the advantages or disadvantages of DSOs, because there are both. There are both, but I will make some comments that are going to raise some eyebrows and probably raise some criticism. Never been afraid of criticism, and I'm welcome, as I always say, welcome criticism and welcome comments, but these are facts. And I am old enough, I'm old enough to have witnessed what I called the golden age of medicine and dentistry, the golden age of medicine, which I speak on more frequently than the golden age of dentistry, is when the physician, and in this case, surgeons, I'm a surgical person, had total control over his entire practice and destiny. And shortly after I entered the professions, that began to change, slowly at first, then rapidly. And over the first 20 years of my practice, most physicians lost most of the control of their practice, where by the year 2000, 2005, just about every physician had joined a larger organization to stay viable. That's a good way to say it. There are other ways to say that. But by the beginning, sometime around the beginning of the 21st century, most physicians who used to be independent and have one or two doctor practices had joined much larger organizations, some of them centered around hospitals and some of them independent, physician-owned or operated large organizations that supplied physician services throughout the United States of America. That same thing is happening in dentistry and has been happening in dentistry for the past 20 years, first slowly, and I can make a comment or two about that. For those who are interested or those who are familiar with it, and for those who are not familiar with it, let me just say that when dentists began organizing a group of practices together, it began as just the dentist being in control of those practices. And then shortly thereafter, business interests found that there was a significant amount of profit to be made by taking over the business end of a dental practice, like any other kinds of business, allowing or having the dental practitioner completely limit his services to patient care and providing the back end or business services to the dentist, and supplying all the things to the dentist that the dentist really didn't like to do. And that is where DSOs began. And now they're taking off logarithmically. And within the next 10 years, you'll see 80 or plus % of practices being organized similarly to, not identical, but very similar to the organization that medicine went through, medical doctors went through. And being both a dentist and a medical doctor, I get to see it twice. Now, let me make a comment about why that happened. Medicine happened a little differently because of insurance and the facts that hospitals started to coalesce first before the independent doctors did. But when hospitals began to coalesce and join forces and develop large hospital corporations, and again, I was on the cutting edge of that here in Nashville, Tennessee, which is really, Nashville, Tennessee, besides Music City, USA, it is known as Healthcare City, USA. A huge number of healthcare companies are based here in Nashville, Tennessee, because Nashville is where Hospital Corporation of America began its trend to develop a network of hospitals. And literally, I was on the cutting edge of that as a very, very young surgeon, wide-eyed and bushy-tailed. I would sit in the surgeon's lounge at the original hospital for Hospital Corporation of America, Parkview Hospital, and Dr. William Frist, Dr. William Frist Sr. Would come in, and he would talk to the young boys and tell him all of his experiences that he did as he developed the first hospital, which was the beginning of Hospital Corporation of America. So again, I got to witness the condensation or condensation or development of dentistry, medicine, and the hospital itself. So I go back a long way, just out of interest. I'm familiar with the problem. I'm familiar with the advantages. I'm familiar with the disadvantages. So in dentistry, here is really what generated the opportunity, and that is, I'll explain it this way. As a young oral and maxillofacial surgeon, I had the opportunity to go around and visit every dentist that I could find as I built my practice, telling them who I was, what I did, how I performed, and why I performed different kinds of surgery, and asked for referrals. Over a period of the first 10 to 15 years of my career, I interviewed and had lunch with at least 400 dental practices throughout Middle Tennessee. Each and every one of those interviews, I would ask the doctor at some point why he liked being a dentist. What do you find interesting about being a dentist? Why do you like being a dentist? And the answer is always, most of the time, I would say, and I don't exaggerate this number, at least 90% of the time, I'd hear something to the effect that, well, I like dentistry because I get to see what I actually produce. I feel that it's a really good service for patients. I really like most of my patients. Some of my patients are a little difficult to deal with, but generally speaking, I really enjoy talking with and serving most of my patients. And then they would hesitate and eyeball me directly. And 9 out of 10 of those doctors would look at me and say, but my staff drive me nuts, or something to that effect, maybe even using a little different vernacular than that. Because of that, when companies came around knocking on the door and said, we can take over all of your headaches associated with your staff and keeping staff and hiring staff, training staff, disciplining staff, paying the staff, the doctors listened and they were very interested. And that's still the way it is. That is the biggest impetus why DSOs are now growing logarithmically. And the word is out that it is a viable way to practice. And for sure, as I am told, that now the majority of young dentists coming out of dental school start out in dental service organizations. They may not end up there yet. There may be some that proceed into more private practice, individual practice, but more than half of the young doctors graduating from dental school, that means over 50%, are going to DSOs. And I also listened to the statistic this weekend, more than half, I think it was a little more than 60% or 60%, 61% of graduates from dental schools are now females. So heavily weighted toward female dentists and weighted toward dentists going into DSO organizations. Directly from well-established information from the DSO industry itself. So why am I talking about this? Because there is an influence two ways. There's an influence from and by DSOs on temporomandibular joint disease, and there is an influence of temporomandibular joint disease on DSOs. And I'll try to discuss both of those, hopefully, within the next few minutes. Let's take the second one first. The influence of TMD on DSOs. Well, right now, as in any business at any time, including your major corporations, your car manufacturers, any industry in the United States right now is trying to figure out how to stay viable. Any brick and mortar company is starting to feel the pinch of increased interest rates and significant increase online purchasing. All these things are changing our economy and changing our culture greatly. And those changes are going to change dentistry precipitously and significantly and similarly over the next decade. And how all this washes out is partially predictable. I'm certain there'll be things that are kind of unpredictable that comes from it, but the predictability is that there'll be more competition. There'll be more of the larger corporations figuring out how to do it better, faster, more efficiently in any kind of service or purchase, including dental services and purchases, so that the dental service organizations are also looking for ways to decrease cost, increase income, increase efficiency, bring on artificial intelligence. It's a big topic of this conference, artificial intelligence and how it applies to dentistry, and how to bring all of this newer technology, which has plenty of it, into dentistry to increase profits. We are a capitalistic system, and I think we will maintain a capitalistic system in this country. So with that as an assumption, we're not going to lose that interest in increasing profits for any business you're involved with. So we're in the dental industry, and DSOs are going to be more and more prominent in the dental industries, and they are very much interested in increasing their profits for their shareholders, which you can be one, or you can start your own DSO and join the movement. So I'll just give you another word about something, a word to define, and that is a word as far as how profits are considered, or how the metric used to determine whether any business, dental business or any other business, is successful, and that is the metric of EBITDA. Without getting into accounting principles, EBITDA is defined as earnings before interest, taxes, depreciation, and amortization. But the word EBITDA was bantered around frequently at this conference in certain panels, not in every panel it was discussed, but in great amount, and that EBITDA, interest before, earnings before interest, taxes, depreciation, and amortization is how any business measures its viability. The greater the EBITDA, the greater it's viable, the greater it's worth. So businesses are measured on their EBITDA, and EBITDAs are under attack right now in any business, but including the dental industry. And so DSOs are looking for ways to increase EBITDA, which can convert into decreasing costs or increasing income. So they're working and talking about how to do both, getting more done with less people, driving more patients in, or in our case, and I'm going to get to the point, having additional services that dentists can do that increases the volume of patients and increases the value of income per patient. Now we're talking about good services, viable services that people actually need and want. So with that regard, treating TMD problems, disease, successfully, predictably, is very important if you are going to increase the number of patients and the number of dollars that you drive into a dental organization. And that is why the Urbanic Device and Protocol and my presence at that meeting was exciting to me and exciting to many other people in the industry who I was able to talk to about what we've established and what I've discovered about treating TMD. What they see is an opportunity to drive more needful patients into a dental practice, have them treated, and because the device is a medical device without a CPT code and a fee for service, and basically a cash service, DSOs are increasingly interested in that service to increase EBITDA. So very simple. The principles are simple. It doesn't have to be complicated, just like the device itself is very simple and how it works. That's really what we discovered. So the DSO industry is here to stay, and take it any successful device for the treatment of TMD will drive, if used correctly, will drive more patients into a dental practice and bring in more and better business, which whether you are an independent doctor with your own practice, one doctor, one office, or whether you are a DSO with 1,500 offices, it is obviously painted and made present at this conference that they want more different kinds of services that could apply. So from the DSO point of view, they certainly would relish and include any traditional services, but certainly a unique service that they haven't been using before. And there are several of those. I was exposed to a couple of them besides my own that are coming down the pike. Really, really interesting stuff. So between the push from what treatment of temporomandibular joint can do for a practice, or in this case DSO, or the pull from the DSOs wanting more patients, wanting more income, wanting more EBITDA, it's a win-win situation. I mean, dentists, as we know, have recently significant problem finding staffing. It was noted multiple times how difficult it is and how expensive it is to find new hygienists, the number of doctors. The number of dental schools is increasing, but not rapidly enough. There's a greater need for dentists than there are young dentists available. There are greater need for oral and maxillofacial surgeons than there are oral surgeons available. This is really absolutely true. So, you know, it's a professionals market right now. I won't go deeply into that, but the things I heard were totally different than when I began practicing began practicing of any kind, basic practice in 1976, where, I mean, you were on your own. You could start a practice. All you had to do is hang a shingle and have enough money to buy the equipment and rent a space, and there you go. But nowadays, it's a multi-million-dollar business to even get into the DSO business, and even as individual practice, you're talking, $1 million plus just to start a practice. All right, the second point I want to make is this relatively new concept that is being promoted by the DSOs, what is called the mouth-body relationship or connection. The DSOs have now recognized as a method to increase patient flow, increase EBITDA, and increase services, that a method or a movement needs to be made to connect the dentist more in line with the physicians. In other words, to put the dentist profession, dental profession, medical profession closer together so that they can work together for the patient's benefit, for sure, but also to get better services and to provide a better service so that the organizations that provide these services, the DSOs, have more affluence and have more presence and can expand more rapidly. So that's called the under different statements or words, but generally called the mouth-body connection. And that is promoted by one of the biggest DSOs in the country, which is Pacific Dental. And their CEO, Steve Thorne, actually did a webinar on this recently where he talks about it and promotes it rapidly. And I couldn't agree more. We all know that periodontal disease, or at least you should be aware if you're a general dentist in the middle of the 21st century, that there's great science showing that chronic inflammation associated with periodontal disease has significant effects on the systemic diseases, especially heart disease and diabetes, anything having to do with the immune system. And recently, I completed one of the episodes, you can look back and watch on it, which I spent a little time researching specifically, and that is chronic inflammation, which is the whole problem of TMD, chronic inflammation, not muscle problems, not myofascial pain dysfunction syndromes. Chronic inflammation of these joints create all the symptoms, and there is more chronic inflammation on a affected joint, a TMJ with disease. There's more chronic inflammation in these joints than there is in periodontal disease. And as far as volume goes, more chronic inflammation having deleterious effects, negative effects on other systemic diseases, including heart disease and diabetes and others. That is being discussed now. There are scientific papers and scientific studies that are focusing on that. But what I discussed a couple of episodes ago was how much chronic inflammation is in these temporomandibular joints. Actually, when you calculate it out, more chronic inflammation here than you get chronic inflammation regarding in and around 28 periodontally involved teeth. That is significant when it comes down to the mouth-body connection. So obviously, if you can decrease inflammation in periodontal disease or decrease inflammation in temporomandibular joint disease, you are doing the patient a huge service, which is connecting the dentist to the physician, the dental establishment to the medical establishment, the dental profession and medical profession should have long ago got a lot closer than they are right now. I think it's time for the dentist. I spoke on this, so we have an episode and quite a bit of several statements, information about how, in dental school, they need to stop being educated as tooth technicians or tooth mechanics. Dentists are equipped, they have the basic sciences, they take the basic sciences and to be more integrated in their part and be the oral physician that they should be. Dentists should be the oral physician, the physician of the oral cavity. It's a very complex thing. This is more than just 32 teeth, a lot more. And as an oral maxillofacial surgeon, I got to experience all of that, and my connection to the medical establishment, spending really my career in the hospital, not in my office, made that point, not only to my dental colleagues, but to my medical colleagues. So I've always lived that life, but I see that it has been not carried through in the dental profession. So that really is my point my major point of this episode. The treatment and successful treatment of TMD is really, the poster child of bringing together the dental and medical connection. I mean, this is a joint of the body, identical in operation to any other joint in the body. It is untrue that these joints are so different and so unusual. These joints operate like any joint. They are smaller. They are a little differently involved. They have two joints attached to one bone with 32 teeth attached. That is all true. But the physiology, the neuroanatomy, the pathology, the way inflammation operates, inflammation in this joint is just like inflammation in the knee. same inflammation. And it operates the same way. And I've spoken before that, and this may, if this is the first episode you've seen, but tennis elbow and TMD are the exact same disease. I'm not going to go into that again. It's on a previous episode. Tennis elbow and TMD are the same disease, just different joints, different parts of the body. And that's a fact. And I discussed it. So regarding the mouth-body connection, TMD is the poster child for that, if not periodontal disease. They both go together. And more inflammation with TMD than there is in chronic inflammation associated with periodontal disease. Last point I want to make, just as an aside regarding this meeting, is very, very interesting, extremely well attended meeting, very exciting. People are passionate about what they're doing, very, very passionate about the DSO industry, presently and in the future. But one of the things that surprised me, and I will just preface that by saying, as DSOs developed over the past 25 years, when it first started, it was called, it didn't even call it dental service organizations, an association of collective practices or something like that. 20 years ago, it was coined as dental service organizations. But the point being, for the past 25 years, since its inception, the American Dental Association has considered DSOs stepchildren. Pretty much every state board, dental board, considered dental service organizations as questionable in their value, and certainly questionable and many times on their legality. Well, that has changed. That has changed. Again, I'm not beating the drum for DSOs. I'm just telling you what's happened and happening. At this meeting, I had the opportunity to sit at a table with one of the board of directors or trustees for the American Dental Association. Actually, you sat at my right elbow. Happened to sit down at that table, and found out the gentleman sitting next to me was a trustee to the American Dental Association. And we began talking, and I wondered, what his interest was at attending the DSO meeting. And then he pointed out that the table in front of us sat a woman who is the current president of the American Dental Association, an older woman, and that we were about to listen to the first panel, of which one of the panelists was the director of the American Dental Association. And he was asked multiple times during that panel what his thoughts are about the relationship for the American Dental Association, the executive director speaking on what he thought the future was, and the relationship was from the American Dental Association to DSOs. And he had a presentation, a little short speech that was very positive and acknowledged the importance of DSOs. Basically, it was the American Dental Association at that particular meeting, at that particular time, throwing in the towel and saying, we give. The DSOs are here to stay. They have to and need to be a part of dentistry. And obviously, with the future being 80% of dentists actually being part of DSOs, it was inevitable. But it happened last weekend in Denver, Colorado. And I was sitting right there in back of the president of the American Dental Association, and on the screen, along with a panel of other esteemed DSO members, was the executive director of the American Dental Association, basically conceding, without using that word was not used, conceding that you're with us and we're with you now. With that as the end of this, I hope that's a little stimulating for you if you're in the dental industry, if you're a dentist. I use it to encourage you. I use it to just tell you the facts. That's what I always do. That's what I've always done. That's what I tell you about. That's what I speak on, that's what I educate on. As far as TMD, I did figure it out. I figured it out 12 years ago, what everybody missed. You can look for yourself. You can study it yourself. You can think through it yourself. It makes sense when you actually look at it that way. It's all about inflammation in these joints. If you can make inflammation in the temporomandibular joint go away, then you can make the symptoms go away. If you can figure out a better way to make the inflammation in these joints diminish, rather than using a device that separates the back teeth over a period of time using a proper protocol, I'm all for you. I think that maybe there is a better way to do this. We know non-steroidals work really well, but only for 3 weeks. What do? They decrease inflammation. That's what they do. If you take a device and you put it in between the front teeth and use it correctly, you got to be able to speak with it in your mouth. You got to be able to swallow it within your mouth. It has to stay in your mouth. It can't be too obtrusive. The only time you need to take it out of your mouth is when you chew. And if you can do that long enough, according to proper protocol, basically it needs to stay in your mouth for the first 2 months, 24/7 to get the effect, then the inflammation decreases enough for the symptoms to diminish and go away. And then it's nighttime only the rest of your life. That's the protocol. If you can figure out a better way to do it, I think you'd be successful. I haven't been able to think of a better way, but I did come up with this, and my patients led me to it. My patients gave me the key. They kept saying if I put a pencil, eraser, my tongue, a piece of cloth, my finger between my front teeth and gently bite down, it feels better. No matter how much you clench or grind, that's not the point. And that's where this started 12 years ago. And now the whole industry is changing right around us. I hope you've enjoyed my comments. I hope it didn't upset you too much. I am not interested in upsetting anybody. I'm not upsetting anybody who has another theory about temporomandibular joint problems. You can have your theory. I just am on a mission to tell the truth, to tell what I've found, to tell what I know, and to tell it far and wide as I can for the patient's benefits. You've heard my stories about patients. This is a huge problem. There are millions of mostly women in the United States who suffer daily, significantly with the symptoms of TMD. And my company and myself have the mission to change that and to fix that with as many people as rapidly and as soon as possible. I look forward to the next time we can speak. I'm Tony Urbanic. If you'd like to talk with me, if you'd like to email, I can be reached at tony@tmjservices.net. My director of marketing and education, Dr. Naomi Williams, can be reached at naomi@tmjservices.net. I look forward to any comments, any criticisms. I'm open to discussion. And certainly if you'd like to join our network of doctors who can do this with this device and have the results that we do, please give us a call, give us a text. We're happy to have you join our network of doctors who can do this. Till next time, I look forward to speaking with you again. Have a great week.